Good day, everyone. I am Carl Sisu, an anesthesiologist and a member of the Program for Healthcare Quality and Patient Safety of the University of the Philippines, Manila. Welcome to Module 2, where we will be discussing principles of patient safety. This module is composed of two parts. The first is an introduction to patient safety, while the second is on understanding errors and harm. According to the World Health Organization, or WHO, there is now an overwhelming evidence that significant numbers of patients are harmed from healthcare, resulting in permanent injury, hospital admissions, increased length of hospital stay, and even death. These adverse events occur due to the complexity of healthcare systems today, where successful patient treatment and outcome depend on several factors, in addition to the competence of each individual healthcare provider. Thus, patient safety is an issue in all countries that deliver health services, most especially in developing nations. At the end of this module, we should be able to define safety and quality in healthcare, explain the concepts of error and harm, apply patient safety thinking in the delivery of healthcare, and apply a systems approach to patient safety. The first section of this module is an introduction to patient safety. WHO defines patient safety as the reduction of risk of necessary harm associated with healthcare to an acceptable minimum. It is also defined as the avoidance, prevention, and amelioration of adverse outcomes or injuries stemming from the process of healthcare. Leaders in patient safety have also defined it as a discipline in the healthcare professions that applies safety science methods toward the goal of achieving a trustworthy system of healthcare delivery. As an attribute of healthcare systems, patient safety minimizes the incidence and impact of adverse events while maximizing recovery from these. Patient safety is an essential component of quality of healthcare services. It is only one aspect of the broader concern of quality of care, which encompasses efficiency, effectiveness, timeliness, equity, and patient experience. So why is patient safety relevant to healthcare? Many studies confirm that healthcare errors are prevalent in our health systems and that the associated costs are substantial. In the United States, healthcare errors result in at least 44,000 unnecessary deaths each year. In Australia, errors result in as many as 18,000 unnecessary deaths and more than 50,000 disabled patients. A study from the UK reports that 3.6% of hospital deaths were due to preventable medical error. In a Norwegian study, medical errors cost 4.2% of hospital deaths. A BMJ meta-analysis in 2019 concludes that at least 1 in 20 patients are affected by preventable patient harm, with 12% of this group suffering from permanent disability or dying because of this harm. Now, let us take a look at local Philippine data on the burden of medical errors and harms from care. In 2017, the Philippine General Hospital, or PGH, had an overall prevalence of medication errors of 97.8%. These were errors in prescribing, patient compliance, medication administration, and dispensing. Similarly, the Philippine Heart Center, or PHC, in 2010, reported errors in prescribing, order processing, dispensing, and administering. So going back to our question on why patient safety should be prioritized in healthcare, we see that there are significant economic and human costs associated with adverse events. Efforts to improve patient safety in the US from 2011 to 2013 resulted in a total of 1.3 million fewer hospital-acquired conditions, or HACs, among hospitalized patients. 50,000 fewer patients died in the hospital as a result of the reduction in HACs, and $12 billion in healthcare costs were saved. These were attributed to concerted attention by hospitals throughout the country to reduce adverse events. Likewise, implementation of safety and quality in healthcare in Australia from 2013 to 2018 resulted in improvements in patient outcomes. With these, we recognize that there is a need to reduce the harm and suffering of patients and their families, and acknowledge that there is compelling evidence of the economic benefits of improving patient safety. In this regard, it is important to remember that several system factors come together to impact patient safety. These factors include regulatory, institutional, administrative factors, the work environment, team factors, individual staff, family, and patient characteristics. Hence, it is important to educate the members of the healthcare system on the science of safety. This can be done by using strategies to improve system performance, which can be achieved by standardizing care whenever possible, creating independent checks, and learning from defects in the system. These safe design principles must be applied to technical or clinical work as well as teamwork. Remember, the teams make wise decisions when there is diverse and independent input. And finally, communication must be effective. That is, it should be complete, brief, clear, and timely. We end this section of the module with a framework for safe, reliable, and effective care from the Institute for Healthcare Improvement. This provides clarity and direction to healthcare organizations on the key components involved in achieving safe and reliable operation excellence, or simply a system of safety. The framework describes two foundational domains: culture and the learning system. Culture is the product of individual and group values, attitudes, competencies, and behaviors that form a strong foundation on which to build a learning system. A learning system is characterized by its ability to self-reflect and identify strengths and defects. Here we also see the 9 interrelated components: leadership, psychological safety, accountability, teamwork and communication, negotiation, transparency, reliability, improvement and measurement, and continuous learning, and how these components interact. The core of the framework is the engagement of patients and their families. It is the engine that drives the focus of the work to create safe, reliable, and effective care. This framework can be both used as a guide in applying the principles contained therein, as well as a diagnostic tool to determine how well a health organization or system is pursuing the different components of the framework. Thank you very much for listening. Maraming salamat.